Here are 10 USMLE-style multiple-choice questions on amino acids, each with an explanation. 1. Amino acid metabolism, homocystinuria. A 25-year-old man presents with fatigue and dizziness. Blood tests reveal megaloblastic anemia. Further analysis shows increased levels of homocysteine, but normal methylmalonic acid levels. A deficiency of which amino acid precursor is most likely responsible for this condition? A. Phenylalanine. B. Methionine C. Tryptophan. D. Histidine. Answer B. Methionine. Explanation: homocystinuria results from impaired metabolism of methionine, leading to increased homocysteine. Elevated homocysteine with normal methylmalonic acid suggests folate B9 or vitamin B6 deficiency, affecting methionine metabolism. If methylmalonic acid were also elevated, it would suggest vitamin B12 deficiency. 2. Essential versus non-essential amino acids. A 7-year-old child with severe malnutrition is diagnosed with kwashiorkor. His diet is deficient in several essential amino acids. Which of the following amino acids must be obtained through his diet? A. Alanine. B. Glutamine. C. Tyrosine. D. Methionine. E. Serine. Answer D. Methionine. Explanation: essential amino acids cannot be synthesized by the body and must come from the diet. Methionine is essential, while alanine, glutamine, tyrosine, and serine are non-essential. Tyrosine is synthesized from phenylalanine, so it is conditionally essential in phenylketonuria, PKU. 3. Amino acid metabolism disorders. Phenylketonuria, PKU. A newborn presents with vomiting, musty body odor, and developmental delay. Genetic testing confirms a deficiency in phenylalanine hydroxylase. Which of the following amino acids becomes essential in this condition? A. Tyrosine B, tryptophan C, methionine, D. Cysteine, E. Proline. Tyrosine. Explanation: PKU is caused by a deficiency in phenylalanine hydroxylase, preventing the conversion of phenylalanine tyrosine. Since tyrosine is normally synthesized from phenylalanine, it becomes essential in PKU. 4. Urea cycle disorder. Ornithine transcarbamylase deficiency. A 3-day-old newborn presents with lethargy, poor feeding, and respiratory alkalosis. Laboratory studies reveal hyperammonemia and elevated orotic acid levels in urine. Which enzyme is most likely deficient? A. Carbamoyl phosphate synthetase 1. B. Ornithine transcarbamylase. C. Argininosuccinate synthetase. D. Argininosuccinate lyase. E. Arginase. Answer B. Ornithine transcarbamylase. Explanation: OTC deficiency is the most common urea cycle disorder, leading to hyperammonemia. Elevated orotic acid results from excess carbamoyl phosphate, which is converted into orotic acid. Carbamoyl phosphate synthetase 1 deficiency also causes hyperammonemia, but without orotic aciduria. 5. Maple syrup urine disease. A 5-day-old infant presents with poor feeding, irritability, and a burnt sugar smell in urine. Genetic testing reveals a deficiency in branched-chain A-keto acid dehydrogenase. Which amino acids accumulate in this condition? A. Lysine, methionine, arginine. B. Phenylalanine, tyrosine, tryptophan. C. Valine, leucine, isoleucine. D. Alanine, serine, glycine. E. Aspartate, glutamate, proline. Answer: valine, leucine, Explanation: MSU is caused by a deficiency in branched-chain A-keto acid dehydrogenase, preventing the breakdown of branched-chain amino acids BCAA, valine, leucine, and isoleucine. This leads to neurotoxicity and the characteristic maple syrup odor. 6. Alkaptonuria. A 45-year-old man presents with dark urine, joint pain, and bluish-black discoloration of ear cartilage. His symptoms are due to a deficiency of which enzyme? A. Homogentisate oxidase. B. Phenylalanine hydroxylase. C. Tyrosinase. D. Branched-chain A-keto acid dehydrogenase. E. Cystathionine beta synthase. Answer: homogentisate oxidase. Explanation: alkaptonuria is caused by a deficiency in homogentisate oxidase, leading to homogentisic acid accumulation. This causes dark urine, alkrinosis, bluish-black pigment in cartilage, and arthritis. 7. Cystinuria. A patient presents with recurrent kidney stones. Urinalysis reveals hexagonal crystals. A defect in which transport protein is responsible for this condition? A. Cystathionine biosynthase. B. Ornithine transcarbamylase. C. Cysteine transporter. D. Sodium-potassium ATPase. E. Phenylalanine hydroxylase. Answer: C. Cysteine transporter. Explanation: cystinuria is due to a defect in renal tubular reabsorption of cysteine, ornithine, lysine, and arginine, choleamino acids. Hexagonal cysteine crystals in urine are characteristic. 8. Hartnup disease. A child presents with pellagra-like symptoms, diarrhea, dermatitis, and dementia. Urinalysis shows excess neutral amino acids. The symptoms are due to a deficiency in which vitamin? A. Vitamin B1, thiamine. B. Vitamin B2, riboflavin. C. Vitamin B3, niacin. D. Vitamin B6, pyridoxine. E. Vitamin B12, cobalamin. Answer C. Vitamin B3. Explanation: Hartnup disease is a defect in neutral amino acid transport, leading to tryptophan deficiency. Tryptophan is a precursor for niacin, B3, so deficiency causes pellagra-like symptoms. 9. Homocystinuria versus Marfan syndrome. A 15-year-old boy presents with lens dislocation, downward, intellectual disability, and thrombotic events. What enzyme is most likely deficient? A. Phenylalanine hydroxylase. B. Branch-chain acetoacid dehydrogenase. C. Cystathionine beta synthase. D. Homogenosate oxidase. E. Tyrosinase. Answer C. Cystathionine beta synthase. Explanation: homocystinuria is caused by cystathionine beta synthase deficiency, leading to homocysteine accumulation. Symptoms resemble Marfan syndrome, but with intellectual disability and a downward lens dislocation. These USMLE-style questions cover key amino acid disorders, metabolism, and clinical applications. Let me know if you want more. Here are 10